Hey there, it's Dr. Mandigo, and I am psyched to talk about cervical cancer screening with you today. That is one of my favorite topics in women's health, and there's so much to talk about. So, we're going to start off with just a tiny bite, and we're going to talk about pap smears. So, when cervical cancer screening first started, this is what we did: pap smears. And a pap is a very specific procedure that tests for just one thing. There's tons of misconceptions about this. I field questions from patients all the time who aren't sure whether or not they had a pap smear. So when you go to the doctors, like a primary care doctor or an OBGYN, and they have you up in the stirrups, they'll place a speculum inside your vagina in order to look through your vagina to your cervix at the top. And then they'll take a brush and get a sample of the cells from your cervix and send that off to the lab. Then a different doctor looks at those cells under the microscope and lets the other doctor know, were those cells normal or precancerous or cancerous. So the pap is a specific test that is a screening test for cervical cancer to look for cervical cancer or precancer. So not uterine cancer, not vaginal cancer, not ovary cancer, only cervical precancer or cancer. So if you went to the doctor and you were having vaginal discharge or odor or itching and they did a swab, they may not have done a pap smear. They may have tested you for yeast or BV, but you might not have gotten cervical cancer screening. If you went to the ER because you were having abnormal bleeding and the doctor did a pelvic exam, they did not screen you for cervical cancer. So it's really important to know what exactly a pap is and what it tests for. And it's crazy to me that we don't talk about this with women, even though all of us are going to have many pap smears done throughout our lives. But now there's another test for cervical cancer that sometimes you get done with a pap smear and sometimes instead of a pap smear. And we're going to talk about that next time.